Implementing policies is one of the best ways to address men's health issues, such as prostate cancer, mental health, substance abuse, and others. By creating policies, the government is able to enforce regulations that will better the lives of men and boys. Some examples of these positive policies are the Consolidated Appropriations Act of 2024, the Mental Health Parity and Addiction Equity Act, and the Delaware Workplace Wellness Policy and Procedures. All of these policies have improved the health of men by providing funding for cancer research, expanding access to substance abuse treatment, and developing wellness programs to educate men about their health. All of these policies have improved the health of men by providing funding for cancer research, expanding access to substance abuse treatment, and developing wellness programs to educate men about their health. Some proposed policies that did not get implemented that would have further improved men's health are the Men's Health Awareness and Inclusion Act, PSA Screening for Him Act, and the Comprehensive Paid Leave for Federal Employees Act. By analyzing proposed legislation, Men's Health Network aims to create models for future propositions that would get passed. One positive policy that addresses men's health is the Consolidated Appropriations Act of 2024. This act allocates $110 million for the prostate cancer research program in the Department of Defense. This program was started in 1997 and has been conducting research and working to close the gaps in patient care. Giving the prostate cancer research program millions of dollars will help them continue the critical work that they do for service and non-service members that are battling prostate cancer. Not only does this program focus on people who have been actively diagnosed with prostate cancer, but also aims to improve the quality of life in men to help them prevent the development of prostate cancer. The Consolidated Appropriations Act of 2024 also gives $14.2 million for prostate cancer prevention at the CDC as well. Both of these programs developed life-saving research and information for men that deal with prostate cancer. They have helped expand the life expectancy of men that are diagnosed with prostate cancer, develop new methods of treatment, and reduce the disparities in high-risk populations. In 2008, the Mental Health Parity and Addiction Equity Act was signed into law. This act addresses how substance abuse disorder treatment was not accessible for certain populations. By implementing this, health insurances are now required to include substance abuse treatment in the same category as general medical coverage. This means that anyone experiencing substance abuse can now seek treatment and have their health insurance cover some of their costs. In the terms of this law, it states that copays, deductibles, and out-of-pocket maximums cannot be any more restrictive than the benefits that someone receives for general medical expenses. Men are more likely than women to be struggling with substance abuse disorders. Creating laws like the Mental Health Parity and Addiction Equity Act will expand the access that men have to getting treatment. Substance abuse treatment saves lives every day by preventing overdoses, brain damage, liver damage, and other life-threatening outcomes of continued use. This has a large impact on men's health because it is allowing many men to receive the treatment they need for substance abuse disorders. In 2022, the Delaware Department of Human Resources created the Workplace Wellness Policy and Procedures. These guidelines are meant for the executive branch agencies to help them develop workplace wellness programs. These programs include healthy eating, exercise, tobacco prevention, and preventative care. There are also aspects to promote social and mental well-being for employees as well. These include stress management and mental health resources. Since the state of Delaware is the largest employer in the state, they believe they need to set examples for other companies to follow. Even though these policies are targeted towards everyone, men lack social support at a much higher rate than women. Many healthy eating, exercise, and weight loss resources are typically only catered towards women. Giving men access to resources for their own health can help them develop more healthy behaviors. With the gender lifespan gap increasing, the importance of workplace wellness programs is heightened. These programs will help men feel like their health concerns are being heard and provide them with ways to work on themselves in the workplace. Some proposed policies that would have improved the health of men are the Men's Health Awareness and Inclusion Act, PSA Screening for Him Act, and the Comprehensive Paid Leave Act for federal employees. Men's Health Network helped write and propose the Men's Health Awareness and Inclusion Act that called for the creation of an Office of Men's Health within the Department of Health and Human Services. Establishing this would have created federal funding for men's health research and helped create other policies that target other men's health issues as well. The PSA Screening for Him Act was sponsored by Senators John Boozman of Arkansas and Cory Booker of New Jersey, and is also known as the Prostate-Specific Antigen Screening for High-Risk Insured Men. This act would waive cost-sharing requirements for prostate cancer screenings for men with the highest risk of developing prostate cancer. Providing these screenings for high-risk men will help detect prostate cancer early on. Detecting prostate cancer earlier would have helped save the lives of many men. Another proposed policy is the Comprehensive Paid Leave for Federal Employees Act. This act would have expanded access to paid paternity leave for federal employees. Paternity leave helps men form closer bonds with their children and other family members. All of these proposed policies would have greatly improved the health of men. At Men's Health Network, we advocate for positive policies to improve the health of men. We have helped propose multiple policies to lawmakers in efforts to get some of these things passed. Unfortunately, our Men's Health Awareness and Inclusion Act did not pass in Congress. Despite this, we still continue to meet with policymakers to inform them about current men's health issues. We believe that federal legislation and funding can be one of the best ways to improve the health of men across the United States. Providing resources that address all different types of men will be beneficial because some populations are at a higher risk of developing certain health issues. We acknowledge this as we continue to meet with lawmakers and push for them to understand the circumstances that some men face. Our proposed legislation can be used as a model for future policies that may be proposed. Even though there are many policies that were not adopted that would have been great for improving men's health, Men's Health Network sees them as ways we can continue to advocate. In conclusion, there are definitely some great policies that improve the health of men across the United States. The Consolidated Appropriations Act of 2024, the Mental Health Parity and Addiction Equity Act, and the Delaware Workplace Wellness Policy and Procedures. These policies all work together to better the health of men, but there is still a lacking in legislation that addresses men specifically. At Men's Health Network, we strongly acknowledge this and push for the implementation of positive policies that impact men. Thank you for taking the time to watch this video, and I hope you learn more about how positive policies can improve the health of men.